Day. Um, Welcome to Chai with Cheruba. We're going to be talking about a really fun topic today and would love to um, speak with you guys. Type in the chat, where you're joining in from. Grab your cup of chai and come join me as we talk about concierge-style GYN care. I'm really just excited to be here to talk about this topic. I feel like I've been talking about it a lot, so um, I looking forward to answering questions and objections and comments on this topic. So, all right, let's get started. So, um, imagine a situation where you are desperately trying to reach your doctor. So, I'm a gynecologist, so I'm going to give a GYN example, something that I see all the time. So, you're bleeding really heavily. This is really not your standard. You're usually somebody who gets your period every single month, and now you're just hemorrhaging. You don't know what's going on. You're typing in the portal to your doctor, and it says that you will hear an answer within 48 hours. You're calling the office. It's a call center type situation where they say they will give your message to the doctor, but then you don't hear, and there's no way for you to directly speak to your doctor. It's just somebody answering the phone. And then, you're then starting to type in like urgent care. And maybe you're starting to go to the ER because now you're a little bit lightheaded and you just don't know what to do. You take a Motrin, you take an Advil, and you're thinking, this has never happened to me before. What can I do? And you have a gynecologist. You see them every single year. You go get your pap, you get your mammogram, all those things. And you have somebody. You're not one of those patients who's hasn't seen a doctor or has lapsed in their care. You have health insurance. You pay every single month for your health insurance. You're doing all the things. There is nothing that you have lapsed on, but yet you cannot get a hold of your doctor. So now you're faced with the problem of heavy bleeding, starting to really just not feel well, and trying to figure out what could possibly be going on. And I need help ASAP. So you are left with probably having to go to the urgent care or maybe even an emergency room, which is going to be more expensive. You're going to have to wait there for hours. You've got maybe your kids to pick up from school. All you want is just to hear and speak to your doctor. But that does not seem to be happening, and it just does not be is not something that you are able to do despite having a doctor. So if this sounds familiar, type in the chat yes, because I feel this kind of scenario is often something that happens to women. And I'm talking just about gynecology, but you can extrapolate this to anything. Maybe you have a sore throat and you're coughing. You don't know if it's just kind of a walking pneumonia. Is it the flu? Do you need medication? That's one example. Maybe you're a parent with a sick kid and they have a rash, and you're thinking, is this a rash that I need to stay home from school for? Do I need a note? Do I actually need an appointment? Is this the sign of something more serious? Maybe you're maybe you have an elderly parent and they're getting a little confused, and you're thinking, well, is this dementia? Is this a side effect of a medication? Is something in their blood level off? Like, you're trying to troubleshoot these things. So this is a common experience in the United States, regardless really of who you are. And as a gynecologist, I see that first example all the time when patients are like, I couldn't get a hold of my doctor and I was bleeding. So this is a conundrum in the United States. We all know that the healthcare system is less than ideal in terms of access. We have some of the best doctors, the best technology, all of those things. But when it comes to access, when you're actually having a problem, it seems like the Holy Grail. Can't get a hold of your doctor. And this is increasingly becoming an issue, and to the point where many patients are just told by their doctor, like, hey, okay, if you're having all those things, go to urgent care. And they're thinking, well, why am I paying all this money to have health insurance when I'm just going to go to urgent care anyway? So it's a frustrating position to be in as a patient. And as a physician, you're often, working seeing 20, 30 patients a day. When I was in corporate medicine, that was the case. 20 patients was like standard, maybe 25. And so you just literally had 10, 15 minutes with a patient. And so if you're a doctor like that, and you're suddenly somebody's telling you, giving you a call about, oh, I'm having bleeding, then imagine that takes another 20 minutes to talk to that patient, and now you're really back, from your clinic schedule. So it's not a great position to be in as a doctor either, because as physicians, we want to give the best care to our patients. We want to listen. We're trained to do all of that, but the logistics just make it impossible. And so it's a tough situation to be in on either side, as a provider, as a doctor, and as a patient. And so that's why we're talking today about concierge-style GYN care and why that's the future. In fact, concierge-style medicine, I should say. Again, I'm talking about GYN because I'm a gynecologist. And in my practice right now, we are out of network with insurance. And the reason we did this was for exactly the reason that, the kind of scenario that I described. If a patient does call me and say, oh my goodness, I'm having this, I can totally squeeze that patient in during the day to figure out what's going on before I just say, go to urgent care or go to the ER, because I have the bandwidth to do that. So what is concierge style medicine? Now, there are many, many forms of this throughout the country, but essentially, this type of medicine removes the middleman, which is the insurance company. Okay, takes away the insurance company, so you are dealing directly with the patient. The patient pays you. You provide services to the patient. You can still use insurance for labs. You can use insurance for, if you want to do an ultrasound or a CAT scan, or any of those things, you can absolutely use it. But when it comes to actually your physician services, you just pay directly. Now, for some practices, you pay a monthly fee. For other practices, you just pay, whenever you see the doctor. So my practice is the latter. You don't pay a monthly or a yearly fee. If you come to see me, you just pay at that time. And if you just see me once a year, then you just pay once a year. So there's pros and cons to both models, which we won't get into. But the whole idea is you are directly having a relationship with the physician, and insurance companies are not in the middle. And the reason I bring that up is because the reason doctors have to see 20, 30 patients is reimbursement from insurance is actually really poor. So you could do a really complex diagnosis, really complex problem. You could do this complex surgery, and yet you just don't get that much reimbursement. So in order to keep your doors open, you have to see more patients. So it's a numbers game. And if insurance companies actually reimbursed better for some of these things, we could see fewer patients and provide better quality of care, and patients could use their insurance. It would be a win-win for everybody, but that is not the current case. Insurance reimbursements are actually dwindling. I just read a statistic that currently doctors are being paid less than what they were being paid in 96. And the rate of inflation obviously has skyrocketed. I mean, this doesn't make any sense, right? No other field is this happening. But as doctors, this is what we're having to deal with. And so doctors are having to crank up the number of patients seen per day in order just to keep the lights on. And so contrast this with concierge style or boutique GYN, or boutique medicine. It's you're no longer answering to the insurance companies. Patient pays you for the care, and that's the end. Now, some patients will say, "Oh my gosh, but why should I do that? Like, why do I need to pay extra to see my doctor when I'm already paying for insurance?" And I get it. It's super frustrating that you are spending so much money on insurance, and then in order to seek concierge care, you have to pay more. But here are the top 3 reasons why I think concierge style medicine and concierge gynecology is the future. So, number one, you're going to get time with your doctor. You're going to know exactly who you're going to see. It's not like you just make an appointment with the office and you could be seeing a doctor, you could be seeing a nurse practitioner, you could be seeing a PA, or you could be seeing another doctor than the one you made the appointment with. That kind of stuff doesn't happen in concierge style. You know exactly who you're seeing. It is going to be your doctor or somebody from your care team that you know ahead of time. And you get time. So an average appointment in my office is about 45 minutes. Now that is unheard of in the GYN world. Usually appointments are, 10 minutes. Breast exam, PAP. If you have other questions, make another appointment. That is not the case in our office. We spend 45 minutes to an hour with every patient, going through their history, hearing their story, and putting together a diagnosis. And an office visit, is actually pretty complex. You have to get the history of the patient, and people often come with complex stories about things that happened to them, surgeries they had, other medical conditions, tests that they had to do, things that did not work out for them in the past, and they're looking for further answers. So you have to get all that history, right? Then you need to actually examine the patient and see what clues you can get. And then you have to put the picture together and say, this is, what I think could be going on, right? And sometimes they bring other test results or ultrasounds or MRIs. So you're actually looking through those. And then it's like a puzzle. You're putting it together. And then we're talking about treatment. Okay, here are all the options. You could do this, you could do that. Here are the pros, the cons. Let's choose one. And then you're scheduling a follow-up to see how all that works. So it's actually, a complex process and easily takes 45 minutes to an hour for, a new patient. And so you get the time. You, as a patient, you feel like, okay, I'm able to tell my story fully without missing, links or just throwing in little pieces here and there. I'm able to give the full story. I'm able to be heard. Here's all the things that are going on with me. I can't tell you how many patients say, oh, I just felt so dismissed by this doctor, or, they just didn't listen to me. In concierge style medicine, you actually get the time. So number one, time. And a good history and physical can save you multiple visits that you may otherwise have to have in a traditional practice, or it can save you multiple doctors' visits. So it can actually save you money. I'm a gynecologist, but I do take care of sometimes other things for my patients, versus in a traditional system they would then have to go and see somebody else, and so that's more time, more money, and it's just not needed. So time is number one. Number two is access. So you actually get access to your doctor. It depends on, again, what style of concierge or boutique medicine you're part of. Some people will say, oh, you can reach me 24/7. Other people will say, okay, 9 to 5, you can call me. But the thing is, when you call, you will actually get an answer, and you will get your doctor to actually call you back, which is amazing. And often in these practices, a live person picks up the phone. So in our practice, there's no call center, there's no automated phone tree where you have to leave a message. A live person always picks up the phone, which is so nice. So you can just ask your question and get your answer versus staying on hold forever. So access is huge. So, what is the point of having a doctor and paying for insurance and all these things if you can't even access your doctor? And so in the example that I first gave you with the patient with a heavy bleeding, when you can access your doctor, you can quickly get on the phone and say, okay, this is what's happening. Your doctor is going to give you, a few things to check or do, or, hey, come in, let me just examine you. Let me see what's going on. And then truly, if you need to go to the ER, that's a different story. But at least we've been able to take a first look. And often that's all you need. You just need some reassurance. You need a quick treatment that your doctor can just give you. So time is number one. Access is number two. And when you get access, you can often get your problem resolved within a little bit, versus spending all that time in the ER. Okay. And number three, when you do concierge style medicine, you're getting a network. And I cannot state this enough. In the business world, we say your network is your net worth. And similarly in medicine, your concierge doctor knows so many people, and all they have to do is take out their cell phone and text, my patient so-and-so, needs to be seen ASAP for this. Can you get them in? No long waits and sending a referral and then waiting for 3 months and all of those things. And that can be priceless. So when you pay for concierge medicine, you are paying not just for your doctor's knowledge and the access and the time. You're also paying for the network of your doctor, which is amazing. I mean, I have friends in pretty much every specialty. So when a patient says, "Oh, I'm having this really hard thing, I can't get in," there's at least 3 patients in the last year who've come to me with a breast lump, and I say, "Hey, I'm not. This is not looking good. I really think this could be cancer." We get imaging and then it's like, bam, we need a biopsy. Okay, the next biopsy is 4 weeks away. Not in my practice. I call my friends, I get my patients in, within a couple of days. And when you have what you think is breast cancer, nobody wants to wait for 4 weeks to get a biopsy. So my network is amazing, and I'm going to use it for my patients who need it. And so that's just the most tangible example I can give you. I can just think of 3 patients already who I have needed to pull that card for. And you know what? They're so grateful. And I know if I needed a biopsy, I don't want to wait all those weeks, wondering what's happening with me. So those are the 3 main reasons why I think concierge style medicine is the future. Number 1, you get time with your doctor. Number 2, you get access to your doctor. And number 3, you get access to their network. And all of this, ironically, at the end of the day, can actually save you time and money, and put you in better health, of course. And so if you are stuck in that mentality of, "Oh, I'm just, I pay for insurance and I just want to pay my $20 copay," think about what you may be missing. And everyone's healthy until they're not, right? So many patients tell me, "Well, I don't need to see a doctor. Like, I'm fine. Like, everything is going well with me. I really have no problems." Well, you have no problems because you haven't really seen a doctor who has then been able to diagnose things that are going on with you. So access to a doctor is critical. I really encourage everyone to see their doctor every year. Certainly a primary care doctor, but definitely your gynecologist as well. It is a myth that you don't need to see a gynecologist after you have kids. That is such a myth. You really do need to see a gynecologist every single year. There's so many preventative things that we do. There's so many things we pick up. Having babies, one can argue, is the easier part of a woman's life. There's so many other issues that come up later that you should, really be seeing a gynecologist every year. So think about, how you want to use those resources. Think about what it is, you value in life, and think about, concierge style medicine. I really do think it's going to be the future. There's waves of it happening here in the West Coast and in the East Coast. And I think it is going to be the way of the future. So I'm happy to take some questions if you guys have any about concierge style GYN care. Yes. Do we have a text messaging system set up with patients? Yes. It doesn't come directly to my cell phone, although I can look at it, but they can text our office. And because our office is so small, it's just one doctor and one medical assistant. We constantly know what's going on. And so, yeah, it's really great. You don't always have to use the portal. You can just quickly send a text and it comes right to us. Good question. Is concierge care accessible or affordable for most women? I would argue yes. Depending on where you live, like in my area, I went to just get a haircut and, blow dry. I paid almost $200. And just for a little bit more, you could get an annual exam, but from your doctor once a year. So it really comes down to what you value. And that's what I'll say. Not all of my patients are super rich or anything like that, but they value their healthcare. So they may say, okay, I'm not actually going to go out to that fancy dinner where I would have spent $250, for my family. Instead, I'm going to use it for my healthcare. And I really respect those decisions. And I think it really comes down to what you value. Because if we think about how we spend money, I mean, we're all spending money on a lot of things. So it just comes down to what it is you value. And I absolutely think it is affordable. And I have patients from all strata of society, work, people who don't work, all of the things who find a way to see me. Okay. What should patients look for when searching for a concierge GYN provider? Yes, that's a good question. So I think in general, you want to see what your price point is. When we say concierge, there's very few GYNs who have like an annual fee. So for example, if you saw a concierge internist or a primary care doctor, they'll often say like, okay, my yearly fee is 2,500. It can go all the way up to $40,000. Okay, so it's a wide range. For gynecology, you want to see, do I have to pay per year or do I pay, just as I go? So in my practice, you just pay as you go. So for a lot of people, that's a little more reassuring. They just say, okay, I just need to go once a year. I want really good care, but I, don't want to pay $5,000 because I just see my gynecologist once a year. So that's something you want to find out. And then you also want to just see, well, who else is in the office? How does it work in terms of, who I'll see? What are the wait times for an appointment typically? Those are kinds of the things you want to see. And then if you have any specific problems or pre-existing issues, you want to see if that doctor is an actual match for you, right? So maybe you're starting menopause and you want to find a concierge doctor who does a lot of that. Or maybe you've got fibroids or endometriosis. You want a doctor who actually does those surgeries. So maybe you're actually looking for your niece or your child or somebody who needs their first GYN exam. So does that doctor do that kind of thing? So making sure that what you're looking for is matching up with the skills of that physician is important. There is a concierge OB doctor in the Bay Area, Dr. Justin Thompson, who is amazing. And so if you're thinking, well, I want just the most exclusive birth experience and I want somebody to answer all my questions and be there for me, then you're going to want to find a doctor who actually delivers babies, right? Which we don't do in our practice, but Dr. Thompson does. And so you just want to make sure that you find that kind of match. Okay. Any other questions? What inspired you to start a concierge GYN practice? So that's a great question. I was in corporate medicine for about 8 years. It was a great experience in terms of the number of patients I saw, the types of things I did. But at some point, it really started to feel robotic. Like, okay, I got to see 20 patients today and I can only spend this many minutes. And, it's a little tiring to grind like that and not have time to like really think about complex problems. It's always like putting out fires, but not really getting to the depth and the core of the problem and solving it for the patient. And so I just felt like that's not the way I wanted to go. I wanted to see fewer patients, spend more time, and it was like, okay, how can I make that happen? And so that's how I started Concierge GYN. And also at this point in my career, I wanted to do a lot of speaking. I want to educate women in different forums. I have my social media, I have the Chai with Cheruba, my YouTube channel, all these things that I just wanted the freedom to do, practice medicine in my own way. And so that's why I started this. Do patients have access to their chart notes anytime at your office? Yes. So we make those accessible. So you can go to your portal, you can see notes, you can see labs, you can see your imaging, you can see where we sent referrals to. So you can see all of that. Absolutely. Can I message my doctor directly? Yes. So patients send me messages all the time on the portal. And then on the weekend, those, if they text our office, it comes to my phone. So yeah, you can definitely get a lot more high touch with your physician. It depends on the practice. Some will have 24/7. Like if you're a primary care doctor, some will say, oh, you can call me at midnight or you can call me at 2 a.m. Other people will say, well, if it's not an emergency, you're not going to hear back from me. My regular hours are 9 to 9 for contact maybe. But just knowing that you have way more access than a regular doctor, makes a huge difference. Yes. concierge care for teens or first-time GYN patients, absolutely. I have several patients whose moms are my patients and then bring their daughters because they say, okay, this is nerve-wracking, my daughter is anxious, maybe she has a history of trauma, whatever it is, we don't want a quick 5-minute exam. I really want someone to talk my daughter through everything and do a gentle exam, give some alternatives, have different size speculums, and really make it a tolerable and an experience that is not traumatic. And so, yes, this is a great option. Yes, we do offer virtual appointments. Yep. We see patients on televisit all the time. What other questions? Can I get same day or next day appointments? Absolutely. In our office, that's what we do. Same day or next day. It's definitely available. And that, again, to my point about access, you can definitely access your physician. And if, sometimes if I'm in the operating room, my staff is taking a message and they're texting me, oh, so-and-so looks like you really need to call them back, having this kind of issue. So you just have access, which is great. Yes, absolutely. One of my specialties is menopause. And so we spend a lot of time talking about menopause and hormones and testosterone and estrogen and adding and subtracting and kind of tweaking that to really help patients feel better. So absolutely. I would still recommend insurance because that way you can still use your insurance for lab work, tests, hospital procedures, all those things. So it's really nice to still have your insurance. You're just not using your insurance for the office visit. That's the difference. Okay. What happens during the first appointment? So it really depends on the type of visit you're coming in for. So if it's a menopause consult or a surgical consult or an annual exam, the types of things that we do are a little bit different. So yeah, it just depends on what you're coming in for. But the bottom line is you're gonna have way more time with your doctor. Yeah. Okay, guys. Um, I hope this was helpful and gave you like an insight into concierge style medicine, especially GYN medicine. I'm Dr. Prabakar. I'm an OBGYN and a fellowship trained minimally invasive surgeon. I'm in the Bay Area and I opened up my concierge style GYN practice almost 3 years ago. We've served over 1,000 patients, and we've just brought on another seasoned surgeon as well, Dr. Lee Christensen, who also does complex endometriosis and pelvic pain surgery. We are in Lafayette, and we see 8 patients a day, 8 to 10 max, and we see as young as 9, 10, and as old as like patients in their 90s. Our oldest is 96. And so we take care of all things, GYN. We don't do OB, so we don't deliver babies, but we do everything else in gynecology. So it's a one-stop shop, and we'd be thrilled to see you at our office. Again, we're in Lafayette, California, in the Bay Area. But if you're anywhere in California, you could do a virtual visit with us, super easy. And visit our YouTube channel, The Fibroid Doc. Follow us on Instagram and tag a friend who you think could really use this information on concierge style medicine, specifically GYN, because as women, we want time, we want our questions answered, and we deserve to get the care we need. And we are taking care of everyone else and doing all the things in society, but we have to take care of ourselves as well. So definitely recommend this. All right. Thank you, everybody. Yay. Thank you, Wendy. All right. Everybody have a wonderful day. Have a wonderful long weekend, and we'll see you next Thursday. Okay. Bye.